Welcome. Thank you for joining us for the 2013-2014 Open Enrollment Employee Benefits presentation. The Open Enrollment page is now available on the Pima County Benefits website for your review. Pima County's healthcare objectives remain the same. There are no plan design changes for next fiscal year. Pima County's objective is to continue to provide a comprehensive benefits program, continue to provide incentives for healthy living in order to improve employee health, safety, and productivity. Aetna has been selected as Pima County's medical plan administrator. Aetna has a large nationwide provider network, programs and services that can help you get healthy and stay well as a user-friendly website with many online tools to help you understand your medical plan and make the most of your benefits. You can contact Aetna by calling their member services number at 1-800-784-3989 or by logging on to their website. Aetna is there to provide you with help whenever you need it. Open enrollment begins April 15th this year and runs through May 10th. You should receive your new medical card from Aetna about the third week in June. Pima County's plan type is Aetna Choice POS 2 Open Access. You may want to write this down as you will need this information when you log on to Aetna's website to search for your doctors. To search for your doctor on the Aetna Provider Network, go to www.aetna.com. Since we are not technically Aetna members until July 1st, 2013, in order to search for your doctor, you will need to select Not an Aetna Member, and then search our public directory in order to find participating physicians. Please reference the plan type above. If you are currently enrolled in a medical plan that you are happy with and would like to stay with that same plan next year, you will not need to re-enroll during open enrollment. However, you will need to log on to ADP in order to recertify your healthy lifestyle premium discounts for the new plan year. You can do this during open enrollment beginning on Monday, April 15th. Transition of care. Employees currently undergoing treatment or who have a procedure scheduled with a physician who is not contracted with Aetna may request to transition care. Transition of care is temporary coverage you can receive when you become a new member of Aetna. If the doctor who you are currently under treatment with or scheduled to have a procedure with is not contracted with Aetna. This coverage is temporary and its length may vary based on your condition. Transition of care does not apply to primary care doctors not contracted with Aetna. It is specifically for those who are currently undergoing a course of treatment where it is not advisable to change physicians during the duration of treatment. A transition of care request form can be found on the Pima County Benefits website and will need to be completed and submitted to Aetna. These forms can be submitted as early as June 10th, but must be received no later than September 28th, 2013. Pima County will be using Aetna's formulary, and you will continue to have two ways in which to fill your prescriptions. You may visit a participating retail pharmacy for up to a 31-day supply of medication, or you may use the mail order service for up to a 90-day supply of medication. Depending on your plan, using Aetna RX home delivery may save you money on medications you use regularly. Please be aware if you are taking a controlled substance type medication, such as a narcotic, you may be asked to obtain a new prescription from your physician. This is a common procedure that occurs when changing insurance carriers. Pima County's Employee Assistance Program will now be administered by Aetna. EAP offers confidential counseling and other resources to help with a wide range of personal and work-life issues. EAP is offered at no cost to employee or family. You can receive up to 5 free sessions per issue. Your issue does not have to be work-related. EAP is administered through Aetna and is strictly confidential. Other resources are available through Aetna's My Life Values EAP website and include information on child care and parenting, adult care, education, financial and legal issues, health and wellness, and daily life issues. EAP is available to all county employees and their family members. This slide is a comparison of the cost of convenience clinics versus emergency room care. As you can see, it is financially beneficial to use a convenience clinic if the situation warrants it over going to the emergency room. The same holds true with urgent care versus the emergency room. Pima County Employee Wellness offers a variety of programs and activities throughout the year to help you lead a healthy lifestyle with an emphasis on education, awareness, self-care, and behavioral change. By taking simple steps like being tobacco-free, completing the online health assessment, completing a preventative exam, or participating in an exercise wellness program, you're making meaningful strides towards improved health. By completing the 4 healthy lifestyle actions, you may be eligible to earn up to a $20 medical premium discount each pay period beginning in fiscal year 2013-2014. For a complete list of programs and activities, please visit the Employee Wellness webpage. On-site health screenings are also available by appointment only during our open enrollment fairs. Health screenings include a blood pressure reading and a non-fasting finger stick to check your glucose, cholesterol, HDL, LDL, and triglycerides. To schedule your appointment, please visit the Employee Wellness or Employee Benefits webpage. To certify your eligibility for each of the 4 Healthy Lifestyle Premium discounts, you will need to log into ADP HR Benefit Solutions between April 15th and May 10th. You will be prompted to update your beneficiaries, your work and personal contact information, and answer the 4 discount questions. ADP HR Benefit Solutions now displays each employee's healthy lifestyle activities during the reporting year and will be updated each month. Log on and click on the Wellness tab, then choose the Healthy Lifestyle Discounts and Activities page, and you'll be able to see the activities that are on record for you. If you have questions on your eligibility status, please visit the Healthy Lifestyle Premium Discount webpage or contact Employee Wellness at 724-8114 or email wellness@pima.gov. Discount number 1, tobacco-free. You must be and have been tobacco-free for at least the past 6 months. Tobacco use includes cigars, cigarettes, chewing tobacco, pipe tobacco, electronic cigarettes, or any other tobacco product. Discount number 2, health assessments. You must have taken your online health assessment within the past year. Health assessments need to be taken at least once a year. If you aren't credited for having already done so, you can log on to myuhc.com and complete it now. Discount number 3, preventative exam or screening. You must have had a preventative exam or screening within the past year. Eligible examples include routine physical, well woman, well man exam, mammogram, biometric screening, or colonoscopy. To schedule your free on-site biometric screening appointment, please visit the Employee Wellness or Employee Benefits webpage. Discount number 4, healthy lifestyle activities are total points for monthly exercise tracking forms and other healthy lifestyle activities. 10 points will be awarded for each qualifying exercise log submitted each month. A qualifying log will include a total of 600 or more tracked exercise minutes per month. If you submitted logs that aren't listed, please resubmit them to Employee Wellness. Each of the 4 discounts is based on your eligibility between March 1st, 2012 and May 10th, 2013 for your discounts to be reflected on your paycheck beginning July 5th, 2013. If you do not meet the criteria for the discount between these dates, you may begin working towards fiscal year 2014-2015. Discounts for fiscal year 2014-15 will be based on your eligibility between March 1st, 2013 and February 28th, 2014. Healthy Lifestyle Premium Discount number 4 requires you to earn 100 points by participating and successfully completing one or more wellness programs and activities throughout the year. Visit the Employee Wellness webpage to learn more. Log on to ADP and click on the Wellness. Pima County will continue to have 2 medical plans, the High Deductible Healthcare Plan and the Preferred Provider Organization Plan. Both of these plans provide for a national network. Preventative care is covered at 100%. There is no lifetime maximum. You have the option to choose a non-participating provider who is out of network. However, you will have a higher deductible and coinsurance. No referral is necessary, although prior authorization will be required for some services. Pima County's benefit plan year runs from July 1st through June 30th of each year, and our plan designs will remain the same. Let's do a quick review of the High Deductible Healthcare Plan. The HDHP is exactly what it says it is, a high deductible plan. This means you are responsible for paying all of your medical care costs up to the deductible, which is $2,000 for single coverage, $4,000 for family coverage. After you meet your deductible, the plan pays for 90% of eligible medical costs until you reach the out-of-pocket maximum, which is $3,000 for single coverage and $6,000 for family coverage. Then it covers you at 100%. With this plan, all covered expenses, including prescriptions, count towards the deductible and the out-of-pocket max. You do have the option of going out of network with this plan with separate and higher deductibles and coinsurance, and your deductibles do not cross-apply. Preventative services are covered at 100%, and certain medications classified as preventative are covered at 100% as well. The list of covered preventative medications can be found on the Pima County Benefits website. Colonoscopies can be considered preventative, but not in all cases. However, the specialist consult prior to the procedure is not considered preventative, and you will receive a bill for this. All covered discounted medical expenses and prescriptions are applied to your deductible and your out-of-pocket max. With the High Deductible Health Plan, you need to be your own advocate. As such, you will want to become familiar with Aetna.com's Navigator. It is a great online resource to use to price prescriptions, tests and procedures, find doctors and facilities, view your explanation of benefits, see your deductible balance, review your prescription history, etc. Aetna's Navigator will be available to county employees beginning July 1, 2013. The PPO plan includes copays, deductibles, and coinsurance. If you stay within network, your copay applies to primary care physicians, specialists, chiropractic, urgent care, emergency room, and prescriptions. You can also visit a participating convenience clinic for the cost of a copay. Annual deductible and coinsurance apply for other services such as specialized screenings and hospitalizations. The coinsurance, after your deductible is met, the plan pays 80% and you're responsible for 20%. Your deductible starts new each plan year, which runs from July 1st through June 30th. Important information to know about the PPO plan is that the out-of-pocket maximum does not include copays or deductible. It's for coinsurance only. And your copays never stop. So even when you hit your out-of-pocket maximum, you will still have copays. Here are the medical rates for next fiscal year. As you can see, there was no change in the high deductible healthcare premium and a slight change in the PPO premium. This was based on utilization. When comparing plans, it is always a good idea to start with a comparison of the annual premium you will be paying for medical coverage. To calculate this, take the biweekly rate and multiply by 26 pay periods. Then look at approximately how many times you go see a doctor, the prescriptions you take, etc. Comparing these numbers may make one plan stand out against the other. For example, single coverage on the high deductible health plan per year costs $520, and the PPO per year cost is $1,116. Health savings accounts. An HSA is an interest-bearing savings account you use to set aside pre-tax money to pay for qualified medical expenses. You must be enrolled in the high-deductible healthcare plan in order to qualify for an HSA. I suggest that anyone who has an HSA review IRS Publication 502 for a list of qualified expenses. A link to this publication is available on the HR Benefits website. An HSA is owned by the employee. There is no use it or lose it provision. The monies roll over from year to year, and it is portable, meaning if you leave the county, you take it with you. Keep in mind that the HSA is your personal medical savings account. You are responsible for keeping all records. No one monitors your account, so make sure you keep all receipts for qualified medical expenses paid out of your HSA. You will need these for your tax records in case you are ever audited. You may withdraw funds at age 65 for non-medical expenses without incurring a penalty. However, you will have to pay taxes on what you withdraw. In order to participate in an HSA, you cannot be covered under another medical plan, cannot have access to a medical flexible spending account except a limited purpose flexible spending account, cannot be enrolled in any part of Medicare, and cannot be claimed on another tax return. HSA funding. The best part about our HSAs, as you all know, is that the county funds part of it for you. County contributions and employee contributions, if you decide to contribute, are deposited into your HSA each payday. So basically, the county is paying half of your deductible. The annual county HSA contribution is $1,000 for employee-only coverage and $2,000 for employee plus dependent coverage. The funds are contributed incrementally each pay period. You can change or cancel your HSA contribution at any time by submitting a form to HR Benefits. As a side note, domestic partners are not typically eligible dependents for HSAs, meaning that they are not eligible to use funds from your HSA even though the county contributes to your HSA at the higher rate with a GP on your insurance. Your max allowable contribution may actually be at the lower single rate depending upon your family situation. I would highly suggest that you review the IRS publications on the benefits website to find out more specifics on this or contact your tax accountant. The county pays the HSA administrative fee of $1.55. If you disenroll from the high-deductible healthcare plan, you can continue to use your HSA funds. However, you cannot contribute to your HSA any longer, and you become responsible for paying the administrative fee. Open enrollment is the opportune time to review and update your life insurance, including beneficiaries if necessary. Pima County continues to provide $50,000 in basic life insurance coverage and $50,000 AD&D coverage to employees free of cost. You can reduce or cancel your supplemental life insurance at any time. However, you may only increase your life insurance coverage during open enrollment. You will need to do this through ADP. Once you have requested an increase through ADP, HR Benefits will send out an evidence of insurability form for you to complete. The EOI form must be completed and submitted to Humana. Humana must approve your request for an increase before any increase in coverage will take place. Be sure to enter your beneficiary information in ADP. As a side note, this policy does not pay out to minors, so please do not list a minor as a beneficiary. Make sure you designate a trustee or a guardian. Flexible spending accounts and pre-tax parking. The county offers 3 different flexible spending accounts, one for medical expenses, another for dependent care, and one for parking. The annual contribution limits are as indicated on this slide. Medical and dependent care flexible spending accounts are the use it or lose it type accounts. Any monies remaining in them at the end of the fiscal year is forfeited, so remember to be conservative when estimating usage on these accounts. The parking account rolls over from year to year. Keep in mind that you must have funds in these accounts in order to receive reimbursement. Parking paid through payroll deduction will be on a pre-tax basis effective July 1, 2013. So if you currently have your parking deducted directly from your check, you will already be getting a pre-tax benefit and will not need to enroll in a parking flexible spending account. If you park in a private lot, however, and pay out of pocket, you may benefit from a parking flexible spending account. Limited purpose flexible spending accounts are available to employees with an HSA. Limited purpose flexible spending accounts may be used for vision and dental expenses only. Remember, if you want to continue with flex spending, you must re-enroll each year. SunGO SmartCard Bus Pass Subsidy. Effective July 1, 2013, SunTran will launch a new SmartCard fare payment system called SunGO. Initial enrollment will be available online during open enrollment. By enrolling, you will be signing on for a recurring monthly pre-tax payroll deduction. Fare amounts are deducted from the first paycheck of the month. Pima County will be subsidizing 50% of the cost of fare. In order to meet payroll deadlines, any enrollments, changes, or cancellations must be made according to the schedule posted at www.pima.gov/HR. You are able to stop and restart your payroll deduction for SunGO, say if you were to go out on a leave of absence. In order to do this, you will need to complete and submit the SunGO form available on the benefits website. Keep in mind there are no refunds with this program. Once the deduction is made, that's it. No refunds. It doesn't matter if you go out on leave, resign, fail probation, etc. There will be no refunds or credits given. Dental plans. We will continue to provide dental insurance through Pima County self-funded dental and employers' dental service. The annual maximum benefit per person has been increased this year with Pima County Dental from $1,000 to $2,000, and there is no longer a lifetime maximum on orthodontic or periodontic services with this plan. These changes go into effect July 1, 2013. There is a preferred provider directory available for Pima County Dental on the Emeritus website. You may link to this website through the benefits website. Pima County Dental's plan year runs from January 1, 2013 through December 31, 2014. Benefits through Employers Dental Service remain the same. You may locate EDS dentists through mydentalplan.net. Here are the dental rates for next fiscal year. There was a slight increase in dental rates. Pima County Dental is a bit higher due to the increased benefit. Our Vision Plan is one of the many ancillary plans offered to Pima County employees. There was no change in the premiums this year. Inexpensive biweekly premiums provide coverage for frames and lenses. Allowance is given for contact lenses. Additional discounts are available through this plan. Prepaid legal services are available to Pima County employees through ARAG. ARAG offers you fast and inexpensive professional guidance from a large network of experienced attorneys and financial planners for covered matters under the plan. Services are available in person, by phone, or online. You may only enroll or disenroll in this plan during open enrollment. Other voluntary benefits. Aflac offers personal accident coverage, cancer protection, hospital coverage, and short-term disability. Contact an Aflac representative directly to enroll. You will be able to do this during an open enrollment fair, since representatives will be in attendance. Aflac short-term disability is a guaranteed issue plan. What this means is that you are eligible for coverage even if you have a pre-existing condition. However, you must be on the plan for a minimum of 12 months before filing a claim for short-term disability for a pre-existing condition. Please familiarize yourself with the benefits website. All the information we are reviewing today, benefits updates, links to other websites, forms, and benefit notifications can be found on the benefits website. Click on the Open Enrollment 2013-2014 link to get started. Click on the ADP HR Benefits Solution link when you are ready to enroll. Let's review logging into the ADP HR Benefit Solutions website. Your username will be your 6-digit EIN. Company identifier is Pima County, all one word, all lowercase, and your password will be something that you have created. If you do not remember your password, you will need to click on Forgot Your Password, and you will receive an email with instructions on how to reset your password. You get 5 login attempts to this site before you are locked out. If you become locked out, you will need to contact HR Benefits to have your account reset. You may access the benefits website from home. These are the 2 links that you would use. After enrolling in the high-deductible healthcare plan through ADP, you will then need to open your HSA through the Pima County Benefits link. Follow enrollment instructions, provide all required information, including a beneficiary. You may skip the enrollment section that has to do with electronic fund transfer. HSAs are funded by payroll deduction, so this section does not apply. Once enrolled, you will be issued a debit card, which can be used to pay for qualified expenses as long as you have funds in your account. There is an option to reimburse yourself if you pay out of pocket for a qualified expense. You can do this by going to Chase Bank or logging on to JP Morgan Chase Bank's website, registering and submitting information to receive a reimbursement that will be sent directly into your checking account. If you register online with JP Morgan Chase, which is highly recommended, you will be able to view all of your HSA transactions online. The deadline for open enrollment is May 10th, 2013. Please complete your open enrollment by that time. If you have any questions regarding open enrollment, you can ask your Department Benefits representative, peruse the benefits website, attend an open enrollment fair, or contact Human Resources Benefits directly.